for all. We'll begin with the Douglas County Board of Equalization. Roll call, please.
Commissioner Boyle?
Here.
Commissioner Duda?
Here.
Commissioner Kraft?
Here.
Commissioner Morgan? Commissioner Rogers?
Here.
Madam Chair.
Here. Item A, approval of the minutes of the Board of Equalization meeting held Tuesday, January 8th, 2013, and B, call for a meeting and set Tuesday, January 29th, 2013 as a date for hearing on certified assessment corrections reflecting the addition of omitted property to the tax roll or increased value on property.
Motion to approve A and B?
Second.
Any questions or comments? Please vote. Citizen comments. Is there anyone here today wishing to speak to the Board of Equalization about an item not on the agenda? Yes.
I just want to make a brief remark. I had a contact from a taxpayer. We granted her a homestead exemption a couple of months ago, and weeks ago, and I sent out a copy to you of the information from the assessor's office. Apparently, it's something we need to look at again. I don't necessarily want to discuss it now because it's a little complicated, but I just wanted to tell you that I am going to pursue that, and if there's something we need to do, I'll bring it back to the board.
Okay, thank you.
Thank you.
Next are the resolutions. There's resolutions D, E, F, and G.
Motion to approve D through G?
And adjourn.
And adjourn?
The second. Okay. Any questions or comments? Please vote.
Motion passes.
We'll move to the agenda for the Douglas County Board of Corrections. Roll call, please.
Commissioner Boyle, Commissioner Duda, Commissioner Kraft, Commissioner Morgan, Commissioner Rogers, Commissioner Tusha, Madam Chair.
Here. Item 1, approval of the minutes of the Board of Corrections meeting held Tuesday, December 11th, 2012.
Most second.
Any questions or comments? Please vote.
Commissioner Rogers. Motion passes.
Citizen comments. Is there anyone in the chamber wishing to speak to the Board of Corrections about an item not on the agenda? Seeing none, we'll move to the report from the department's director, Dr. Mark Foxall.
Good morning, everyone.
Good morning.
Good morning.
Okay, before you have my report for January 15th, 2013, and I'll call your attention to enclosure number 1, Administrative Services. 6 months into the new fiscal year, the Douglas County Department of Corrections continues to operate under budget. Just a little bit about our billing process with the City of Omaha. They've been billed through October 2012, and they have paid 90% of their invoices through October 2012. The city has audited invoices through August of 2012, and they have paid audited invoice balances through that month, which puts their balance at $62,072. So that's on track and doing well. The FY 2012 SCAP application has been submitted, and our reimbursement $231,125, which is about $100,000 less than what we had last year, but that was anticipated because we knew they were going to draw back on some of those monies. So that was not unexpected. Enclosure number 2. Community Corrections in-house programs, Reentry Assistance Program, formerly known as the Day Reporting Program. Additional membership was recommended by the Reentry Initiatives Council at the December 19th, 2012 meeting. A resolution appointing those additional members will be submitted for approval at the February 2013 Board of Corrections meeting. The Reentry Strategic Plan is developing on schedule. Over 60 people across many different disciplines have been contributing to the development of this strategic plan. The plan will be completed and submitted for approval by the Reentry Initiatives Council, by the end of March and presented to the Board of Corrections for approval. Work release had 40 placements during the reporting period. Approximately 1,700 community service hours were provided by work release clients. House arrest had 66 placements during the reporting month, and they contributed approximately 224 community service hours during the reporting period. Pretrial services program continues to move on track and operate well. 158 placements during the month. 58 individuals were referred for priority prosecution, thus saving 857 bed days. Our GED program is still a shining example of what we can do on the academic front. We had 7 offenders earn their GED during this reporting period. We continue to conduct our internal audit of all of our ACA standards, and that's very important to keep that program on track. Enclosure number 4, personnel. I'm very happy to announce that we had a number of promotions during the reporting period. To Deputy Director John M. Hubbard, a 30-year employee. Sergeants Alexandria Johnson and Theodore Swirsik were promoted. For Correctional Officer 2, we had promotions of Justin Anderson, Christy Finley, William Blair, Alicia Anderson, Daniel Grapp, and Calvin Gould. We had a ceremony in the training room of our facility, and we're very proud of these promotions. And I say again to these individuals, congratulations, and very good start to a very rewarding career. And call your attention to enclosure number 6, a little bit about our population. Our admissions for the reporting period, 1,323. Generally, I report admissions at approximately 1,700, so our admissions were way down during this last reporting period. And in fact, we had, at one point, we were under 70% of our population, and we had 7 housing units closed, which is quite remarkable. I don't remember numbers like this during my tenure, my 12-year tenure. So it's just a point to consider those numbers. The average daily population, consequently, was way down as well to 1,067. The United States Marshal population increased a little bit. The ICE population is down again. The felony pretrial population showed another slight increase, which indicates that the people that we're getting are staying longer, by virtue of the fact that, and I mentioned that by virtue of the fact that our intake population is way down. Female population decreased enough to close the 3rd female housing unit that we typically have open from time to time. I call your attention to enclosure number 7, medical. 1,315 intake screenings. These numbers are down as well as a result of the intake being down. Physical health assessments, 502, and the discharge referrals, 695. The newest enclosure to my monthly report, number 8, mental health. The initial site assessments, 46. Initial mental health assessments, 151. Inmates diagnosed with mental illness, 237. Referrals out to mental health services, outpatient site, medication management, 20. Mental health co-occurring disorder treatment programs, 36. Mental health therapy, 9. So we continue to move aggressively on this front with our mental health staff inside the facilities and our mental health partners outside the facility.
Very good. Commissioner Tusha?
Morning, Mark.
Good morning.
I just want to say congratulations on both overtime and vacation. I noticed those were way down, both of them, and that is awesome. I know we got the holiday that isn't in there yet, and I understand that, but still, much improvement, and I want to say thank you for that. That's very much appreciated.
Thank you. That's something, the overtime is something that we talk about every day, and we're working on that every day and always finding ways to keep that manageable.
Well, you've been doing a great job with that, and I appreciate it. On section enclosure 2, you had made a statement in here that no additional resources were allocated for the house arrest, work release, day reporting, reentry assistant program, and pretrial release, with the admission levels that were higher than any previous the 5 years. That you served 450 additional people for 2011, and I just want to say congratulations to you and your staff. That, especially with no additional, resources for that. That, you've got a great staff here. You've got great working relationship, and I just again want to say congratulations on that. I think that's just totally awesome.
Thank you, and I appreciate that. And we do have a good staff, and I mentioned in the lieutenant's meeting this morning. This is, I think, a lot of good things that we do are not due to one or two or three individuals. Rather, it's all of us, from the CO1 all the way through to the director and the board, and working in concert together to achieve some of these positive
And it's
outcomes that we're
showing
able
it,
to
too.
report. So
Yeah,
thank
right.
you, and go on the record to thank my staff as well.
Yeah,
All of them.
totally agree. And then the page after that, 63 GEDs earned in 2012. That's an all-time record. That is just awesome. That is just awesome. So again, I mean, I'm repeating myself, but again, congratulations to you, again, you and the staff for that also, to have, that many GEDs for the 1 year. So now you know what you have to do for this next year.
Well, my community corrections manager is in the room, Mike Myers, and a lot of the credit goes to him.
Thank you,
and
Mike.
Joe Steinbach as well, and Barb Glazer and Barb Glazeski for pushing the academic piece of what I think is an important component of
Oh, it is.
reintegration to the community.
And it makes these people feel like that they're worth something.
Yes.
Especially when they come in and sometimes they're beaten down, and now, they can stand proud, and it just makes them feel like that they're worth something. So again, that's awesome.
And the GED instructors enjoy the realization that they're helping people move forward and advance in life, and diminishing the likelihood of a return to corrections. So the inmates feel rewarded, and the staff that are able to help them achieve their goals also feel pretty good about it.
It shows, it really does, and that's awesome. I do have one quick question, and that's on number 3, PREA. I'm sorry, I might have missed that before. What does that stand for?
Prison Rape Elimination Act.
Okay, and you said that you've been, over the last several months, to ensure compliance regulations. Is there a lot of demand on the regulations, or is it just real minimal?
No, the regs came out a few months ago. We've been working towards what we believe were going to be the PREA regulations for a number of years now. So when the regs finally promulgated, we were ready. There's a few things that we need to do. We're working with American Jail Association, National Institute of Corrections, to make sure that we are in full compliance. There's a regional training that will be hosted here in the Douglas County Department of Corrections in June for a couple of different training venues, a couple of different areas of compliance with regard to PREA that regional facilities can participate in.
So are those over and above what you're training on now then?
Yes.
Oh, okay.
As a matter of fact, they are. So we're going to benefit from the training. We're going to host it. We will benefit from the training, and other regional facilities in the area will also benefit from the training as well.
Cool. Well, again, like I said, congratulations to you and your staff. You guys are doing an awesome job, and I just want to say thank you for that.
Thank you, ma'am.
Commissioner Boyle?
I really want to say ditto to what Commissioner Tusha said. You're on a really remarkable path and doing a terrific job, and I know that it is a team effort. And you have really assembled a great staff, and I'm very, very happy to see that you appointed John Hubbard, staying inside and making someone like John the deputy with his years of experience. And I think it just adds to the settling at the correction facility, people who know people and are comfortable. So I really want to congratulate you on that, and also wish John well. I know it's going to be another good team over there. I want to also say that the medical RFP was a great success. I was very happy to see the information that was developed from that. I thought it was a very, very good effort, and I haven't made any remark about that until now, but I really appreciate the effort. It was a good, solid proposal, so I really like what you did on that. The reentry strategic plan, I'm glad to see that progressing, because it really is an extension of what you do, and it's a preventative measure, and you're very involved in changing lives, and so this is really a very important thing that you're doing. And finally, I want to ask if it's possible. Some years ago, I asked and got a report, and it was really pretty telling, taking a snapshot of the people who are in the facility on any given day, what their offenses are. Sometimes they're multiple, of course, but it really discloses some of the offenses that put people in our correction facility. And it is helpful because when we talk to state senators about decriminalizing some acts, it is useful to have a snapshot. I don't want you to spend, I know it's going to take a great deal of time, but I suppose if you took, I'll just leave it up to you, whatever you think is appropriate. I think it'd be helpful to all of us on the board to see who's in the correction facility on any given day.
Demographic information and particular charge?
Well, I think charges are interesting. Also, whatever else, what other data you think is important. Maybe it's ethnic background. Maybe it's whether they're been diagnosed mentally ill. Any of those things that you think are important factors that we could use in affecting a good change down there and supporting your efforts. We wouldn't do anything without talking to you first. But I'd be curious because it's helpful to see that every once in a while.
I think it would raise a few of your eyebrows to see what we have.
Okay.
1,074 today,
Yeah.
and I think you'd be surprised at what's in there. And it's pretty sad.
Yeah.
Sometimes.
Well, we might be able to affect some other change. So
okay.
I really appreciate the efforts you're doing. The correction facility is on a terrific, successful path. And it's not an accident. And I'll say once again, it's due to your leadership. And I personally appreciate how you're really handling that facility in such a calm and civil manner. It's really helpful to all of us. Thank you.
Thank you.
Any other comments? Commissioner Rogers?
Thank you, Madam Chair. Mark, for the, I don't know if we talked about it or not, are you all to the point now where you could track, or where Mike could track, let's say, on the mental health piece, the inmates diagnosed, if they come back in? Is that going, like you got the 237, are we able to flag if they come back in within a certain period of time?
We spoke to that at the last.
Yeah, I'm just wondering, we talked about a timeline, and I think I just want to make sure so I don't ask you, and it was like, do we take a 5 or 6 month timeline?
That's something that Catherine Cook and Denise Gaines were working on.
Okay.
It's going to have to be something until we get our new jail management software operational, which, by the way, should be sometime in July, I would think. We're fully operational with the jail management software. And, in fact, we'll have kiosks operational in February. And by that, the kiosks, and I think I've explained that a little bit to you, people can come into the public teller window and they can actually put their money into the kiosk and put money on inmates' books and bond people out and things of that nature. So that's going to take down some of that population, that wear and tear, that movement in and out of our lobby. Inmates will be able to bond out a little bit quicker. They'll be able to get money on their books, but it really works. Plus, it's web-based, so you can actually put money on an inmate's account from your home just by getting on your computer. So it's going to cut down some of that traffic in the lobby. In the past, that's been an issue for us as well. So those kiosks will be up and running in February. So I would encourage you, when you do your next walkthrough of the facility, make sure and I'll be there, make sure that you see the kiosks and the operation of the kiosks as well. But back to your question, sir, when we hit July and we're fully operational with the jail management software, we should have a better accounting of that with information you see. In the meantime, Denise and Catherine are working on a process to try to collect some of that information. It's going to be by hand. So it takes a little bit of time getting it, but we can get you something.
Okay.
But we know who some of the regulars are.
Oh, no, I would, and I just, if it's that, I'll wait. No, I just wanted to, for some reason, I thought we had a timeline, but I forgot, so.
May I address your question?
Sure.
Currently what I do, I have a database that I use right now. It's kind of rough, but whenever I get a client in that's on psych meds, whenever they see the doctor, I enter them into an Excel sheet. So like for last year, I have every inmate, every date that they were seen by the psychiatrist for their initial assessment and any follow-up appointments, any emergency psych med administration. I keep a little database right now so that we can track these numbers.
Okay.
It helps us too, because if we know what we did right a time before, we can help them get back into those services to kind of help reduce their the chances that they'll come back in. So at this point, I could block out their names and just give you their data numbers and show you how often. I could give you last year's numbers, for example, to show
I'm just
you
curious,
kind
is
of.
it like, does 10% of that number re-enter or something
Sure.
like that? Because if it is, then that's a number that we probably need to kick back to the reentry council.
Mm-hmm.
And so I just wanted to make sure. But no, I mean, I just need a number.
Okay.
Don't worry about it.
All right.
All right. Thanks.
Thank you.
So, and the other question, have you all had any follow-up with Cisco about some of that equipment they were talking about and how that could, what the time frame is with that?
Not recently because
Okay.
of the jail management software project, and a lot of those things kind of
Okay.
dovetail together.
Okay.
So we got to push this. We're trying to meet some timelines with the jail management software project, so we haven't gotten back to Cisco.
Okay. All right. Thank you.
Commissioner Kraft?
Yes, piggybacking on what Commissioner Boyle said about the snapshot, that sounds like that'd be a good project if you have somebody as an intern from one of the criminal justice systems schools, or asking one of the instructors if one of their students needs a project.
Sure, certainly. And we've got, as the semester's cranking up, we've got a few inquiries from the various universities and colleges and universities about intern opportunities. So that's something we could certainly delegate.
And the last question I have is, last question I have is, Mike, what day do you want him to use? I'm just kidding. What day? What day? Okay.
Mark, can we go back just a minute on the mental health stuff? And on when did we start tracking that last year? Do you remember what month?
For my enclosure or Denise?
For
Gaines?
the
I believe it was, July or
July.
August.
Could we add another column that just says, 2012, and then put that number next to the month, or next to the, initial psychiatric assessments, and then for 2012, how many were there?
Yes.
Okay.
Yes.
And then on a follow-up to Commissioner Rogers' issue that we talked about, those that are re-entering, and I knew you were keeping track of them, but are we keeping track of the reasons why they had a relapse or a re-enter? I said we talked last time that might be a little bit more difficult, but say the number does come out to be 10%. Of that 10%, was it because they could no longer get their meds, or whatever? I mean, are we keeping some way tracking that as well?
That is a part of the survey that Catherine has put together. So we're going to do this for about 3 months until March, so that we could get a good picture.
Okay.
Yes, and we'll look at that, and then I'll further break it down and look to see of those that of the data that she collected, because she's doing this on every inmate that we encounter through the H&Ps, and then she has an intern that actually went into the mods and collected some more surveys from the inmates. So of those, we can go back and look to see how many of those had mental illnesses, and so we can kind of capture it two ways, looking at those people that are on psych meds and then capturing the information from her survey as well.
Okay, great, thanks.
Okay. May I make a comment?
Uh-huh.
This is not related to what we're talking about, but on behalf of Correct Care Solutions, I just wanted to say thank you for the contract, and we appreciate you looking at us, and we'll continue to work hard to improve what we do and to help add to the value of Douglas County Corrections. Not the value of, sometimes my mouth gets in the way of my brain. We're wanting to add to what they're already doing that's good. That's what I'm trying to say.
No, and you have added the value of our medical services. And I mean, the data and just working with us to make sure that we're providing what needs to be provided, so that we can, one, see a lesser amount enter, but also that reentry piece. So, no, we appreciate that, because you definitely do add the value.
Absolutely.
Thank you.
We thank you for that.
Thank you, Denise.
Thank you.
Anything further, Mark?
No, ma'am.
Okay.
Thank you very much.
Thank you, everyone.
Thank you. With that, we will have a motion to adjourn from the Board of Corrections. Please vote.
I noticed he had his sympathy thing sling off, so.
Take that off.
We'll move to the Douglas County Board of Commissioners. Roll call, please.
Just a moment, please. Motion passes. Commissioner Boyle?
Here.
Commissioner Duda?
Here.
Commissioner Kraft?
Here.
Commissioner Morgan? Commissioner Rogers? Commissioner Tusha?
Here.
Madam Chair.
Here. Item 1A, approval of minutes of Board of Commissioners meeting held Tuesday, January 8th, 2013. Item B, approval of claims submitted for payment process through Tuesday, January 22nd, 2013, and the complete listing is in the Office of the County Clerk Comptroller and available on the web page.
Motion to approve A and B?
Second.
Any questions or comments? Please vote.
Motion passes.
Next is the consent agenda. There's 4 items. There a motion to approve?
So moved.
Second.
Any questions or comments? Please vote.
Motion passes.
Next is recognition and proclamations, and as always, we recognize the previous year's chair, that being Commissioner Mark Kraft, for his service as chair for the Douglas County Board in 2012. And if I may, I'd like to read the resolution. Whereas Mark Kraft served as chair of the Douglas County Board of Commissioners during 2012, and whereas under Commissioner Kraft's leadership as chair, he implemented the Blue Ribbon Committee's recommendations to contract for an operational analysis of the Douglas County Health Center and Community Mental Health Center, as well as a community assessment of behavioral health services. And whereas Commissioner Kraft successfully negotiated a satisfactory agreement with the City of Omaha for the distribution of the 2011 and 2012 Justice Assistant grants, and whereas Chair Commissioner Kraft demonstrated his commitment to Douglas County employees and the county's residents. And whereas Commissioner Kraft sought greater transparency in county government and enhanced communication among county commissioners. And whereas this board desires to recognize Commissioner Kraft's contributions and dedications to public service in his roles of the commissioner and chair. Now therefore be it resolved by this Board of County Commissioners, Douglas County, Nebraska, that this board hereby expresses its sincere appreciation to Commissioner Kraft for his dedicated service as chair of the board during 2012. Is there a motion to
Motion to
approve?
approve.
Please vote.
I was debating if I had to abstain or not.
And look at that, it's taken forever for your votes to come up. We're still debating.
Motion passes.
Thank you all.
Next.
Thank you, Mark.
I would like the privilege of changing my vote from abstain to yes.
Commissioner Boyle
I had to think about
changing
it for a
from
couple
abstain
seconds.
to yes.
Next is citizen comments. Is there anyone in the audience wishing to speak to the county board about an issue not on the agenda? And we do have one. Mr. Lee Legier, our Human Resources Director, is going to talk to us about our celebration on Friday. Did you say,
This
Lee?
Friday, members of County Board, Lee Legier, Director of Human Resources, Douglas County Civil Service Commission. I would like to formally invite the members of the County Board and our employees to our 7th annual Martin Luther King Day Junior Celebration. This is presented by the City of Omaha Human Rights and Relations, City of Omaha Human Resources Department, and the Douglas County Human Resources Department as well. This Friday, January 18th, from 12 noon to 1 o'clock, we will be having our annual recognition of Reverend Martin Luther King's contributions to all peoples. We have Ben Gray, City Council member from the City of Omaha, will be our speaker. And we will also have entertainment provided by Diane Badiato. She's going to be singing our national anthem. And a very distinguished lady, a singer. If you have not heard her sing, this is very worth your while to come and hear her sing. part of our musical presentation, Camille Matoyer Moten. She's just outstanding. And then along with that, we have a young gentleman about age 13 or 14 who has a disability, but he has a voice that will knock your socks off, Lucian Brown. He is just tremendous, and he's very much worth hearing as well. So we would like to invite the board and our employees, our department directors and elected officials to come this coming Friday here in the Civic Center for this annual celebration of the contributions of Reverend King to all the peoples in our society. So, thank you.
Great. Thank you, Lee. Next, we'll move to committees, and doesn't look like we have anything unless there's something under besides the budget report for budget committee. With that, the Human Resources Committee, the weekly personnel report from Civil Services as presented. And then we did get our first legislative report, and there are a couple of items that are noteworthy on this one. Senator Ashford introduced LB 46, which provides for the consolidation and coordination of the crime labs, so we'll keep a watch on that. Senator Shills introduced LB 65, which authorizes the counties to set sheriff fees and commissions. And again, this is not the comprehensive fee-setting bill that Commissioner Boyle had talked about, but this only applies to the sheriff fees. And then additionally, Senator Ashford is working at formulating legislation on the juvenile justice system. There's nothing at this point, but there has been discussion about the closing of the YRTC in Geneva, and then those funds flowing to the Office of Probation, and those would be administered for the Juvenile Justice Center. I know Commissioner Rogers attended a meeting yesterday with our lobbyist for the initial discussions of this, and we'll keep you informed as those meetings continue. And then LB 11 was introduced by Senator Christ, which changes the provisions relating to the surcharge for 911 services. And LB 123 was introduced by Senator Lautenbach for changing the distribution of the indigent defense fees. And we supported these concepts in the past, just to draw your memories. So we'll keep a close eye. I think we're up to 154 bills total that were introduced as of yesterday, and more to come today. So, Commissioner Rogers.
Yep. Madam Chair, if I can put some context around that one meeting tomorrow. Yesterday. The people that I know by name that attended were myself, Sean Kelly, Senator Ashford, Senator Chris, Senator McGill, two individuals from Boys Town at Do Mental Health that have been working with us, I think, with the contract that we have. The director of Voices for Children and the specialist that works with Voices for Children for child welfare and their juvenile justice efforts, and the physical office. The principles of it is going to be they're going to build it off the pilot project that they did here and in a couple other counties and to make it statewide. It'll be ministered by OJS. The money in OJS will go to probation for the project. Senator Ashford is going to go ask for another $10 million to go to county aid, and that should benefit us in some regards if that happens in regards to money that additionally goes to the JAG and some other people. They stress continually the need to do community-based services instead of sending people to the YRTCs and then Kearney and Geneva. They are going to set a definite deadline to close the YRTCs. That's what they will ideally want to do to make that proceed. Probation will highly administer the program, and the suggestion I made to them is that since it's going to be community-based, if there's a best practice element that can be added, whether JDI we put in place or something on a model that you have with the Juvenile Justice Council or the Criminal Justice Management Council, where they would have to get input from the local level to do that. That was received well. They also, well, they're going to transfer all the money. They're going to ask for another, I think he said, 19 million from the governor. And they did say the governor's office was receptive to the concept now. They said the concept and not the money piece. So they don't know where that's going to fall or where it goes. But that was where the meeting went. So I think from there they're going to frame it up and we'll have to be on the lookout for it. So.
Thank you. Commissioner Boyle.
Thank you. I want to mention there's some bills that are in the hopper to change the election commissioner's office. One of them, I think, calls for the election commissioner's appointment to be reviewed by the legislature when the appointment is up, and there's others that change it in a lot of different ways. I heard talk that there might even be something, I haven't read it yet, that may shift the appointment to the county board. There's also talk of expanding the responsibilities of the deputy so that in certain areas, so that changes involving polling places or things that affect voters directly have to be approved by the deputy, and if there's a dispute, it comes to the county board for resolution. So I just want to mention that we probably ought to be keeping a pretty close eye on that to see what our feelings are about those solutions and kind of keep an eye on it. One other thing, I spoke to Senator Ashford about this change in this $10 million appropriation, which would be very welcome. It does, when we initially talked, he mentioned that it would affect the Douglas County Youth Center pretty dramatically initially is what he told me. I said I wasn't really in favor of, turning it over to the state or doing anything like that because, well, their track record isn't that hot. So anyhow, that's what I told him I thought. So we need to work with Senator Ashford. He's very responsive on these issues. So I think it's going to be a good session. We'll see how all this goes, but there are some things we need to kind of eyeball. Thank you.
Yeah, exactly. And I don't think any of us can argue that, the community-based services is probably, well, not probably, but is most likely the better way to go in treating our youth. But what I caution everyone is that, unfortunately, it does have to do with the financing of it. And we know in the pilot project we got dinged a little bit. And so we will definitely stay in close contact during those discussions and see how it goes further. So anything else for the good of the cause? Do we have need for executive? Mm-hmm.
It really goes to Commissioner Tusha and Administrative Services. That's still your committee, isn't it? The city, I just glanced, I don't know when it was, I saw something in the World Herald about they're looking at what to do with Crossroads. And I don't know whether we should be involved in that. I think we should be, I'll put it that way, because this may be a spot for some county services that maybe we should be thinking about. We don't have to make a commitment. But I think the treasurer's been looking at some things, and maybe he got a little bit out front on some things. But I think we need to take a look at and work with him and others to see if this is something that we want to do.
Okay, I'm sorry, can you go back and say what you...
The treasurer was...
the treasurer.
John Ewing had talked about doing a big branch there and closing the one at 84th and kind of making that the central location. And whether or not that's a good thing, I mean, we certainly ought to be considering what John has to say if he's still interested in doing that. But I'd like to see us get in on the ground floor of that discussion on that building before the city moves ahead and turns it into a skate park or something.
And I will follow up with Jerry Leahy to see if he's heard any future input on that, and then I'll inform everybody what's going on.
Thank you.
Thank you.
Before you do that, I do want to make one announcement that we have a new deputy county administrator on board with us, and that being Miss Diane Carlson. And so we are very happy to have you and excited for you to get started. So welcome. I waited to do that.
Maybe you can park in Pam's parking place if you get here fast enough.
Oh, Mark.
First, I want to, Mark Foxall, Director of Corrections, I want to extend my apologies to my invited guest. I should have introduced them during the Board of Corrections meeting, but I thought I didn't have it bulleted out, and sometimes I adhere to the script too much. But I had invited some representatives from the Veterans Administration to speak before you today about some of the things that we're doing in collaboration with them for the veterans in our facility. And we had this big discussion about reentry and reintegration, and it should have sparked my memory, but it did not. But I would like for them to step forward and introduce themselves and talk to you about some of the potential for partnership that we have with them, some things that are going on in Lancaster County that we might look at and potentially replicate here in Douglas County as well.
And with, just to note for the record that we'll be doing this during the Board of Commissioners meeting rather than the Board of Corrections meeting, if everyone's okay with that. Okay.
Thank you, Dr. Fox.
Good morning.
Good morning. I'm Linda Toomey from the VA Nebraska Western Iowa Department of Veterans Affairs, and this is Tammy Osborne. And we'd like to spend a couple minutes this morning talking about the VA's Veterans Justice Outreach Program. So I'm going to give the microphone to Tammy to talk a little bit about our efforts, and then we can talk about greater collaboration between the federal government and the county on efforts for people who are involved in corrections.
Good morning.
Morning.
My name is Tammy Osborne, and I do the Justice Outreach Program for, all of Nebraska, part of Iowa, a little bit of Kansas and Missouri. But we've started, Dr. Foxall and Mike Myers have been extremely supportive. When they've changed the booking system, when they come in, they ask if they've ever served in the military. I get a spreadsheet weekly. We have a peer support program that do jail outreach with me, Mike Brookover, Eddie Nelson, who are present. And we go down and we meet with veterans. And the VA cannot treat the veteran while incarcerated, but our whole goal is to get them and case manage them to the VA, to one of our treatment programs. We have a number of homeless programs, vocational programs, substance abuse, psych programs. And so as far as the city and the county, the VA has expanded enormously the programs in their outreach, and so this is one of them. Pot County does that. We do jail outreach there. Lancaster County, I go to the two jails there. They now identify them at booking. Lancaster County, this is a kind of a new thing. Joe Kelly, our county attorney down there, because from what I understand, financially, a veteran-specific treatment court, and we now have over 90 throughout the U.S., might not be cost-effective. So Joe Kelly and Kim Etherton, Director of Community Corrections down in Lincoln, they started a pilot program, a diversion program for veterans. We are currently seeing veterans who have a diagnosis of PTSD or traumatic brain injury. And then they call me and they say, okay, we have a person, it's misdemeanors only, no DUIs. Joe Kelly or Kim Etherton take the referral. If they accept it, they call me and we see what they're eligible for VA. And then through the diversion program, Kim Etherton has two case managers who meet with the veteran through the court side, and then I case manage through the treatment side. And then we meet about every 2 months, our team. We also have another attorney, local attorney, who sits on our team. He's a Vietnam veteran, and a veteran service officer, and the case managers, Joe, Kim, and I. And so far, we've had a very successful rate. If they complete diversion, their misdemeanor charges will be dropped. And for two of them, we have two who are working for the Guard and they're members of the Guard. So this is a big buy-in for them because their careers are on the line. So it's been it's been very successful. In Sarpy County, same thing. They identify veterans at booking. We go down, we meet with them. The public defenders down there, because it's a smaller system, the public defenders call me directly when they have a veteran, and they really try to get them into the treatment side. And Judge Wester, informally, he's already doing a veterans treatment court. I've had him hand the phone to a veteran at the bench and say, call, you need treatment, you don't need incarceration. And then he'll call them back every 3 months and make them accountable and see how they're doing. So for VJO, it's called VJO, there's 3 basic areas. Education like this, getting the word out, building relationships, letting you all know what we're doing, what we have to offer, which is new, the jail outreach component, and then working with the diversion programs and eventually maybe a veterans treatment court here in Nebraska.
Great.
But so it's working with all the different counties and collaborating care, because I think the VA, I don't think that a lot of people realize how many programs the VA has expanded under Linda's programs, which is homeless. But not everybody I see, of course, is homeless. But, so I think we can be a cost savings.
I think the 2 real things that we have to offer, the case management, linking people to housing and medical services and mental health services after they've been incarcerated or maybe are entering incarceration. And then the other thing of offering treatment instead of incarceration, that whole mental health piece. And certainly it's up to the judge and things like that. But, one of the goals is to look at offering treatment, which is much cheaper than incarceration.
Absolutely.
Very good. There's a few comments here. Commissioner Kraft?
This is all very good. Are you, the 2 of you, also involved in conversation with our community mental health center? I know that conversations are taking place, and also with our long-term assisted living and Alzheimer's units.
We've had some staff leave our employment in the past couple months, so I am going to be taking a very active role in the discussions with Douglas County about people with dementia and mental health services that could be served under your care instead of ours. So I have a meeting later today to talk about how we're maybe going to move those discussions along.
Very good. Thank you.
Commissioner Boyle?
Yes, I just want to say this is wonderful news, really great to hear, and it just kind of fulfills something that I said earlier about the kind of direction I think the corrections is going, which is just wonderful. I want to mention on the Veterans Treatment Court, one of the things that I've discovered with my I'm on a committee that looks at United Way and the diversion that they put in for community services. And one of the things that is really jumped out at me is Judge Lowe on our bench it diverts people by the dozens. And I spoke to him the other day at the swearing in and congratulated him because of his attitude. And he said these people just don't belong incarcerated. So he would be a great contact involving, this would just be a natural fit for him because his attitude is right on point. So I'd like to encourage that contact.
I don't quite understand. I think there's some bigger policy or rules in the state of Nebraska about developing new courts, but I think until the bias on new courts is lifted, those are the type of collaborations that we need to develop, because those are ways where we can have direct impact today regardless of whether or not we can start a new court.
Yeah, whether or not it's formalized or not. If there's some way that, and I'm sure that the presiding judge, Judge Bezos, would be very interested in seeing that happen. The attitude is very good over at the court. But I think Judge Lowe would be a natural, and you could accomplish the same thing without establishing the court system if we could somehow get those folks under his jurisdiction.
That's good to know. The Lancaster County Diversion Program, we did do a breakout session at the Nebraska Bar Association annual conference, and Judge Kim, she was very supportive. She came out for it. Judge Wester from Sarpy County, and then we also, Judge Wester has had conversation with Judge Jordan from East Lansing, Michigan, who's from here, and he flew in to also advocate for what we're doing because he has a treatment court out there. And then we had Matt Steiner come in from the National Association for Drug Court Professionals because he, under that umbrella, he's the veterans advocate. And we had a very good turnout. People are very supportive. I think it's just trying to figure out kind of next steps and how to put things together and what types of cases are we going to take. And
So can we sum up that you're from the government and you're here to help?
That would be a very good summary.
Always here to help.
Yeah.
Commissioner Tusha.
I want to thank you for this because of the fact that they may make a simple mistake, whether, and it's not intentional, but, for some reason they just went off for unknown. We all do it at one time or another. And this way, like you said, it doesn't affect them for the rest of their lives. They can go to diversion, get it taken off of their record, and then they can have an awesome life and not have to worry about that constantly following through their livelihood. So I just want to say thank you for this. This is just fantastic, and I really appreciate it.
Thank you for your support.
There were some questions earlier this morning about what type of offenses we see. Most veterans courts develop out of drug courts, and a lot of the cases that we see that are really diversion appropriate are DUIs and drug offenses and things like that, where we have residential treatment, outpatient treatment, lots of different things that we can offer in that partnership to help those type of offenses into diversion programs and treatment, because they're often probably reoffenders too.
One of the things that I may be able to help work with you on the education and outreach part is I chair the our Nebraska Association of County Officials Health and Human Services Committee, and we have a couple meetings coming up, one being a county board workshop in February. It's in Kearney, but we also have a commissioner from Hall County who is the chair of our veterans committee at the national level. And so it may be worth putting together just a little educational piece and PowerPoint with both of those groups together at either the February conference or, I can call a Health and Human Services Committee. We could do a webinar or something like that. So there's a lot of education and outreach opportunities that I think we would be able to assist you on if you're interested. And
Absolutely.
that would be statewide.
And one other point that we have is we have a peer support mentoring program.
We have a too.
And the VA currently has 29 active peer support mentors. Like I mentioned, Mike and Eddie do jail outreach with me, but that is a key component, because a veteran who goes out and does outreach to a returning veteran, that there's a huge connection there.
There is. We started one on the mental health side through the region, and that's been successful. You probably know Dennis.
Yeah, the region's training many of ours.
I mean, he's done a phenomenal job. And he really pushed for it for a number of years, but that program in and of itself is one that is just spectacular, so that's good to know. Commissioner Boyle?
I want to ask, do you have a relationship with Douglas County Drug Court? It's felonies.
Right. I've dealt with some veterans who are in that drug court to get treatment. Yeah.
Okay. Great. Okay, good. Thank you.
Well,
and encourage them to get treatment and stay in drug court.
So you really have you do kind of the same thing with the drug court, even though it's a more serious charge. Of course, they get if they successfully complete drug court, the charges, I guess, sort of go off the record. It used to be that they were expunged, but the Chief Justice has changed it so that it's not expunged. So that's unfortunate, but anyway, it's the same sort of thing, and I would encourage you. Anything we can do to help that relationship, we'd be glad to.
Yeah, I've gone to drug court with veterans, and verified that they are a veteran. Yes, they are in treatment, and worked with the case managers.
Thank you.
Oh, great. Well, we definitely have a lot of opportunities here to assist you with, so we'll stay in touch.
Thank you.
Thank you.
Thank you so much.
And
Thanks
thank
a
you,
lot and good
Mark.
luck.
With that, just a...
Did you notice that when Mark comes back now, he does have the sympathy
Well,
sling on when he screwed up and forgot
I
something?
noticed him grimacing, so it's for real. All joking aside.
No need for executive session. We do have a couple of notices. Douglas County office will be closed Monday, January 21st, 2013, in observance of Martin Luther King Jr. Day, and the county board will not meet on Tuesday, January 22nd, 2013. So our next scheduled meeting is Tuesday, January 29th, 2013. And again, don't forget about the celebration Friday, January 18th here in the legislative chamber. Okay, is there a motion to adjourn?
So move.
Please vote.
Motion passes.